Good morning, all. So I'm Dragoș Dobre, IT System Architect and Project Leader at Swiss Tropical and Public Health Institute. So today I will present you the Comoros implementation on which we are working together with another organization, which is called IFDS. So the name of the project is Projet d'appui à l'assurance maladie généralisée. So Comoros, it's a French-speaking country composed of 3 islands close to Madagascar and Tanzania in east of Africa. Background and objectives of this project. Basically, the Union of Comoros decided actually to implement the universal health insurance, which is called AMG from Assurance Maladie Généralisée, to support the 2030 emergence strategy. So this program, AMG, aims to provide health coverage for all citizens. So it's mandatory health insurance, combining contributory insurance and state government funded contribution for the poorest. We'll see the different type of levels in the next slide. So this aligns with the global commitments to UAC, Universal Health Coverage, and Sustainable Development Goals, SDGs. The structure of ING, to explain a bit how this scheme is composed. So there are 2 parts of this scheme. IMO, it's a mandatory insurance for people able to contribute financially. So here we can mention those who can actually pay fully, and there are also included the ones who can pay partially. So we can say formal sector and partially the informal sector. Yeah. So in the case of those who can pay partially, so they will pay part of the contribution, and the rest will be covered by the government. And then there is a second part of the scheme, which is IMS, medical and social aid. This is for the poor, the one we cannot pay any part for the contribution, which is fully subsidized by the state, the government. So this is actually managed by 2 funds. So it's a National Solidarity Fund. It is for the AMO, funded by member contribution, so the one we can fully pay and partially pay, and the state support for the partially paid contributions. And the second one is equity and solidarity funds for the IMS part, which is funded by the government and partners. For the pilot, this funded fund will come mostly from IFD. We'll see who is the funder. So the implementation project, what we are talking here about implementing openIMIS and to build this insurance scheme within the country. So it started in July 2022, this project, as I mentioned, PAMG, the name of the project, and the scope is to have a pilot to start in July this year for 18 months. The project is funded by Agence Française de Développement, AFD. So when I said the subsidized part will be funded by partners, so the main partner, part of the government, is AFD to cover the poor people and the subsidized policies contribution part. The organization who is managing this project and basically the insurance scheme, it's UTEGAM, which is a technical unit for health insurance manage, an organization who was created especially for this not this project, but this health insurance in the country. So it will be the one who basically will manage all processes which will cover health insurance for the beneficiaries. Now for the project itself, or for the implementation, so there is a consortium team with IDS as lead organization and Swiss TPH bringing the health financing and openIMIS technical expertise. The team, let's say, so locally we have two representatives of the team leader and the health financing expert supporting the UTEGAM into defining the health insurance processes for their needs and also supporting on every definition of the scheme and conceptualization of the scheme. And on Swiss TPH side, for example, we have Damian, who is a team leader, Damian Revo, Daniela Majakari, and Simeon, who is supporting on the health financing side, and me, Gabriel Dobrovic, I support on the openIMIS technical side. We work with other partners on this project. Why not? From Cameroon for the IT development on openIMIS, but also IT training on openIMIS development. So we had training last years for the local IT organization partner. And built out initiative for development or bid. We will support us for the financing expertise, especially for the training in country, which will be done in near future. And as I mentioned, during the project, local IT partner was contracted by UTEGAM, is eTech. So they are supporting locally to do development and increase capacity, but also it was our recommendation to for the sustainability of the solution after the project is finished. Now, some words about this scheme specificities, because every country, every scheme has their own specificities. So, as I mentioned, there is a local organization who manage the pilot. It's generally valid in all the countries. But in Comoros, there is the notion of polygamic families. So here we have to work and to understand how to manage that within openIMIS. We had later slides with the customization we did, a part of them. So polygamic families brings a bit of challenges because there was many discussion on how to manage the policies, and in the end the policy was decided to be managed on a simple family. So basically we have two levels of family: the polygamy family, which is composed by simple families, and the decision was to have the policy attached to a simple family, and the head of polygamic family, usually the man, basically to be attached to only one of the sub simple family or sub family there. They have a pre-affiliation phase, which they already done to gather beneficiary information. Basically, this information will allow them to define the policy types, basically on different type of schemes. I mentioned before, it's IMO or IMS. Did the families need to fully pay, or do they have to pay partially? They are very poor families, so they will enter into the IMS part of the scheme, so they will be fully funded by the government. So this pre-affiliation allowed for the insurance organization to define which type of scheme will want to attach to each family. This brought us a bit of challenges, and in the end, you'll see we choose to actually implement what we did for the formal sector management as a contribution plan in order to define calculation rules, because all the different beneficiaries will have the same scheme. So you'll have only one product definition within the scheme to have with the coverage of all the medical items and services out there. But the calculation of the contribution value will be done through a calculation rule or a strategy, which is defined by the contribution plans attached to the same insurance product there. Okay. So with that, we also, because there is a pre-affiliation phase and the data is already there within an Excel file, They use the specific tools to do the pre-aviation phase, but all the data was gathered in an Excel file. That Excel file also need to be imported into openIMIS, not to redo all the enrollment phase completely. There is still, after the pre-aviation, a phase where they go back to the families to sign the affiliation form, basically, when they will be fully covered, of course, after the first payment to the contribution. Now, on the contribution, this was a selection. They choose actually the contribution to be paid to only through banks and mobile money. So there are two banks we were in discussion there to integrate with. Unfortunately, well, there's no APIs for those banks, so it's only Excel files when I have to reconcile. And the mobile money, there are two or three operators there, and each one has their own mechanism. One having the mobile money, the other one having like a credit card type of payment through mobile numbers. So different mechanisms with different operators will have to manage. Periodic contribution payment. So the option is here that the beneficiary, they can pay monthly, quarterly, or annually during the signing of the enrollment form. They will have to choose the date when they want to pay into the month or quarterly, the day of the month where they want to pay, but also the periodicity. They want to pay monthly, quarterly, and basically we'll have to manage this periodic contribution payment by creating invoices and sending SMS to the beneficiary to recall them that they have to pay for the next period. Just also to mention, there is a waiting period for of 2 months. So if the beneficiary, they didn't pay for 2 months, so they are still covered. Of course, they need to pay the first month to start the initial policy, to activate the policy. But if they don't pay for 2 months, they are still covered. After beginning of the third month, the policy is suspended. And also this periodic contribution payment has to also to manage the split between the beneficiary amount and the government or state amount, depending on the level of payments it was attached to, as I mentioned before, on the IMO or IMS type of scheme. Another aspect that it was decided is to have only one membership card per family. Usually in all the other implementation of openIMIS, there is a membership card per insuree, but we don't have this case here because they choose to use the plastic cards, and because of the cost, they decided to have only one membership card per family, and this brought additional challenges as if you on the card, they say you have only the insurance number of the head of the family and the spouse, but we don't have the insurance number of all the other member of the family. So when you want to visit the hospital and you want to do inquiring, you expect to see all the members, also mechanisms to see the other members of the family to validate the policy for all the family members when you need any medical treatment there. So yeah, we had to modify there. So the inquiring functionality should display all family members which is attached to that insurance or membership card. There will be new facility types. So pharmacy and laboratories. For now, we only have 3 facility types. So hospital, dispensary, and health centers. So we'll have to have these 2 levels there in order to manage. So there will be claim administrator, if I can call it like that will work from the pharmacy or laboratory to submit claims basically for the medication or services they provided. Some services also require pre-authorization especially for the transportation from one facility or to another, or for a very expensive services, chirurgical services. So pre-authorization is something we don't have in openIMIS. There were discussions about these features. 2M Corp, they did something similar. We had discussion about that. But yeah, we need to look into this pre-authorization and to make to see a generic solution that can work for everyone out there, not to reinvent the wheel for this. And yeah, one specificity, but is less important, I would say, for that doesn't imply customization of the solution, is that the claim review is not done by UTGAM, so the organization managing the health insurance, but by another organization, FENAMUSAC, which is already managing claims for other type of scheme, if I remember correctly, maternity, and maybe accidental. I don't remember. So they have more experience into reviewing claims than UTECAM. So it was decided to give this responsibility to this organization. Now, on the customization. So, of course, most of the customization out there, they are customizing the main forms that insurance families claims to add additional fields or hide some fields. As I mentioned, polygamy family management has to be added in order to allow these two levels of family and the management of the head of the family to attach it to one of the sub-families. Attachments to family and insurance. So we already did this type of customization for Mauritania. So basically we redid that for Comoros to include the documents from the members of the families, especially head of the insurance, but it's also to include copies or scan of the enrollment form that the head of the family actually signs. So you have all the documents grouped within the same family there. Contribution plan to manage informal sector. So this was previously done for the formal sector. So we migrated also to the informal sector, as I mentioned, to define a calculation rule and apply the calculation rule to insurance product that allow to have different contribution calculations based on parameters. In this case, you have the lump sum for the family, and you have also membership. So per person, additional person, because they define the simple family and extended families. So extended families, they will have additional fees per member if it is a woman or if it's child or some specificity as such. And in addition to that, basically it's also the contribution plan was mentioned how much will be paid by the beneficiary itself or how much will be paid by the government of the state there. So the same lump sum and per member values there. Also to mention all this, we have been done not web application, but also in the mobile apps and observation. So one of the challenges it was to have sent the calculation formula from the backend of openIMIS to the mobile apps, which took us a bit of time to define the right way of doing, but that is now done within the mobile apps too. Pre-affiliation data import. As I mentioned, they have this pre-affiliation data for all the beneficiaries, so we have to import that. We have an insurance import module we did for Chad, so we are starting by reusing that module and adapting it to import the data which was gathered from the pre-affiliation phase. Specific reports, I just mentioned some of them, but there are others. So membership form and card. So as I mentioned, membership form, enrollment form, and the specific card format that are generated through reports and the different reports such as how much the government has to contribute to pay in a specific period, and how much it has to be reimbursement to host facilities and others. Another customization is about this bank and mobile payment integration. So as I mentioned, the banks, they don't have any APIs, so all the integration has been done through Excel files that they will send us, and we'll have to import them to openIMIS. We're working right now to do this import, and we'll see if we can automatize somehow this exchange. And the mobile payment integration with different mobile operators. So this will be in a second phase after the start of the pilot, because you prioritize the bank first, and the mobile payment will be integrated just after the beginning of the pilot to allow this kind of payment later. SMS. So SMS will be sent for the initial payment, the first payment of the contribution, for periodic payment contribution, and to also announce different messages to insurers about the activation of their policies or the expiration of the policy because they didn't pay for the last two months. The different SMS template that will be defined to be sent to beneficiaries. Extended inquiring. As I mentioned, in openIMIS, currently inquiring is only showing the one insurer. The insurer, basically, you enter the insurance number. In Comoros, if you enter an insurer number, then you'll see the whole family in which that insurer having that insurance number belong. Pre-authorization. So pre-authorization, we also will do that after the start of the pilot. As prioritization, we did like that in order to allow the start of the pilot, not to delay that. And there is another element. They requested that the prescribers should be referenced in a claim, meaning we should have the list of prescribers or medical doctors or any other kind of prescribers, and then mention who was the prescriber that provided the services, education, so to be referenced that within a claim and then submitted to openIMIS. Yeah, so that will be all from my side. So Simeon and George, who work with us within this project, basically are also in the call. So we are open to questions, and if you have, they can complement or answer to the question if they are more financing related and technical. Thank you.
Thank you, Dragos, for this nice presentation.